In contrast to Western approach, there are 6 pulses in acupuncture which correspond to different organs. They are taken on the wrist and require attentiveness and skill on the part of the practitioner. The patient and acupuncturist should both be relaxed. The pulses are taken at 3 levels of pressure. First, the skin is touched lightly, then slightly harder, and harder again. Pulses can vary in many ways: speed, strength, pattern, reflecting disharmonies in the body. A great amount of information can be gained by this means alone. The insertion of needles into points on meridians requires a practitioner to be thoroughly familiar with the location of points on the patient's body. These points are located along 14 main meridians. Over 2,000 points have been found to exist. However, in practice, less than 200 are usually used. Throughout history, copper or wooden models have been used along with various charts to assist the location of points. Each meridian is named by its corresponding organ, and points along it are numbered sequentially, such as gallbladder 21 or large intestine 13. During treatment, a number of points are taken. The needles themselves have a long and interesting history. The earliest needles were fashioned out of stone, bone, and bamboo. As technologies developed, they were followed by ceramic needles, then bronze, gold, silver, alloy, and stainless steel. Most needles used today are made of high-quality stainless steel. A good needle must be strong, flexible, round, smooth, and pointed to ensure pain-free insertion. Western syringes used for taking blood or for giving injections are very much larger, since they require a hollow core through which fluids must pass. Sewing needles are larger and much more rigid. At one end of the needle is a raised area or handle. These are fashioned in different ways, but serve the same function, providing the acupuncturist with a means to hold the needle. Before a needle is inserted, the area is cleaned with an antiseptic solution. Needles are designed to move the tissue apart rather than puncture it, and often the patient will not even know when a needle has been inserted. As the needles are inserted by the skilled hands of the acupuncturist, the skin may be pressed, stretched, or pinched to facilitate the insertion. They may also be inserted with the aid of a tube, a 17th century Japanese invention to minimize pain. The needle is placed in the tube, set on the skin, and tapped in. The direction or angle of needle insertion depends on the individual acupuncture point taken. The depth varies with the areas of the body, the goal of the treatment, and sensation. The patient may feel a number of sensations at the point: tingling, warmth, or a number of other novel sensations. Once the needles are inserted, the acupuncturist may perform a number of auxiliary needle manipulations, which may include twirling the needle or moving the handle in different ways, each with a unique and different result. For needles to evoke the vital energy they may need to stay implanted, usually between 15 and 30 minutes. The needles are withdrawn painlessly. If a needle is used more than once, it is sterilized in an autoclave, as are instruments in any Western medical clinic. Stainless steel disposable needles are now widely used. These eliminate the risk of disease transmission. They are used once and thrown away. Very thin intradermal needles or press tacks are sometimes used for chronic or stubborn or painful disorders. These are inserted and kept in place against the skin by means of tape, generally up to 3 days. Bundles of dull needles set together evenly are sometimes used. They may have a long handle or be encased in a spring-loaded tube. They are tapped on the surface of the skin, not inserted, and most often used in the treatment of children. A warm needle can facilitate movement through cold meridians. After a needle is inserted upright, a small piece of moxa is pressed into the handle and ignited. This smolders like incense and produces a feeling of warmth below the skin. The process may be repeated till the desired result is achieved. Moxa is made of finely ground mugwort leaves. It is used for its ability to burn slowly and evenly while penetrating mildly beneath the skin surface. It can be shaped into small cones of various sizes and is easy to ignite. The use of burning moxa alone, called moxibustion, is similar to the use of needles in that it stimulates points to strengthen the flow of qi. Moxa is burned on or above the skin at acupuncture points. It is usually used with acupuncture, but in some cases moxa alone may be indicated. Moxa in the form of thin cigars or sticks may be lit at one end and held above the skin to induce a mild warmth. Moxa can be formed into small cones and placed upon an insulating medium. Traditionally, this insulating material is garlic, ginger, or salt. However, commercial cones are widely used with a small cardboard base. These are placed directly on the acupuncture point and lit. Just before it gets too hot, it is removed. This process may also be repeated. Small moxa cones may also be placed directly on the skin, ignited, then extinguished. The patient's condition dictates which use of moxa, if any, is best. Another technique used by acupuncturists is cupping. Cupping is the treatment of disease by means of a suction cup applied to the surface of the skin. The suction is created by the use of heat on the inside of a cup before it is attached to the skin. Traditionally, cups were made from bamboo, ceramic, and brass. Today, most cups are glass. The acupuncturist will sometimes cover the area with a lubricating oil before the cups are applied. This facilitates movement of the cups while on the skin without disturbing the suction. A small cotton ball saturated with alcohol is ignited and inserted into the mouth of a cupping jar. The cotton is immediately withdrawn and the jar mouth is placed firmly against the skin at the proper location. Cups come in all sizes, and one treatment may require the use of several cups. Acupressure, the strengthening and balancing of qi by the use of handwork, can be a very sensitive and important adjunct to the practitioner and can by itself be an effective tool in the healing process. To the patient, it is usually a comforting and relaxing form of massage, whether applied to a local area or the whole body. Another form of treatment is electroacupuncture. First used in China in the 1930s, it now has spread throughout the world. After a needle has been inserted, an electric current is passed through the needle. This can alter and strengthen the nature of stimulation. Among other things, it is used for pain, traumatic injury, and anesthesia. Children may enjoy the benefits of acupuncture also. The very young require only mild treatments to affect results. They may be treated with the tapping or scratching needle, and as the names imply, the needle is tapped on the surface or pulled lightly across the skin. Indirect or stick moxa is also used. Small silver or gold balls called ion balls may be taped onto the skin to stimulate acupuncture points. Alongside the art of acupuncture is the use of medicinal herbs. In China, herbal remedies are used to a greater extent than acupuncture. Developed over more than 3,000 years, Chinese herbology stands well above that of any culture in the world. The major source of books are 1,800 years old. Once the pattern of disharmony is discerned, the acupuncturist chooses a prescription from a repertoire of hundreds of common classical prescriptions. These prescriptions have been proven over the past centuries and extracted from pharmacopoeias and clinical manuals containing thousands of prescriptions and ingredients. These prescriptions are adjusted to suit the patient by adding or deleting various herbs or by adjusting dosages. Herbs from China are used where the science of carefully preparing herbal combinations has reached a very sophisticated level. Remedies may contain from 5 to 15 substances each and prepared with standards guaranteeing freshness and cleanliness. Both acupuncture and herbology give the acupuncturist access to the body through the meridians and together form the basis of traditional Oriental medicine. Diet and lifestyle have always played both a preventative and curative role. Increased public awareness of avoiding chemically contaminated or highly processed foods, reducing consumption of fat and cholesterol, lowering stress levels, and maintaining a healthy attitude lends itself well to the traditional approach. The patient may or may not be asked to partially disrobe, depending on which points are used. Points most frequently used are on the back, below the knees, and below the elbows. Diagnosis continues with the taking of the pulses, examination of the tongue. Treatment begins. The practitioner chooses a set of points compatible with the diagnosis and individualized to the patient's condition. Needles are left in from 15 to 30 minutes, sometimes shorter or longer. Pulses are checked again. Needles are then removed. A herbal prescription may be prepared or recommended at the end of the treatment. For 4 to 6 hours after a treatment, one should avoid doing anything which causes sweating, heavy exercise, hot baths, sex, or consumption of alcohol so as not to drive the heat out of the points and nullify the treatment. The young and old alike can enjoy the benefits of acupuncture. But it is important to keep in mind that the acupuncture process is one that renews your whole body, not just one part at a time, and that treatments are preventative, not just curative. Today, with a continuing and ever-increasing awareness of alternative health approaches, acupuncture stands out as a time-tested and valid healing system.
And it was interesting to me because they treated my body as a whole thing instead of just looking particularly at my back. At any rate, my back has felt better, and I've never had problems with it since then, but I still go to acupuncture for things like stress reduction and colds and sore throats. It's very effective. I can honestly say that acupuncture has made me a healthier and happier person.
The most amazing thing really was that almost immediately I noticed that I thought clearer and my thoughts flowed better. I solved several personal problems and some accuracy and work problems that I had. So it was an amazing experience.
My general impression of acupuncture is that they're very professional. They take a whole body approach as opposed to a cause and effect. I feel better, I have more energy than I think I've ever had, and I've never been treated more professionally even in a regular doctor's office.
I have regained almost full mobility, and for the last year have been almost free of pain. I can't stress the benefit to my general health that came from both the acupuncture and from the acupuncturist's recommendation of certain herbs and other diet changes.
I just feel enormously relaxed and a tremendous sense of well-being soon after an acupuncture treatment. And many times I warded off an impending attack or a severe lung condition or an asthma condition by having the acupuncture treatment just when my problems begin to accelerate.